Hello, my name is Zakir. I'm gonna be your nurse provider today, nurse practitioner. Can you tell me your name, date of birth?
My name is Umaira and my date of birth is 2008.
Okay. Can you give me consent to do the assessment on you and put the video for the school?
Yes.
I'm here, Dad. I'm gonna give a consent too. Okay. What brought you to the clinic today?
For checkup.
Okay. Okay, I will do the assessment, the musculoskeletal system assessment. The first thing is what I'm gonna do is, sorry, get cough. And the first thing I'm gonna do is I'm gonna inspect the hand. I'm gonna do checking if there is no deformity, swelling, any nodules around interphalangeal, phalangeal joint, and metacarpal, carpal, and okay. Then after that, I'm going to check the different type of tests. The first thing is tunnel test. I have to hold it and put it down, and I'm gonna press over here if the patient has a pain. This is a medial, and the medial I have to check it if there is a pain. Both hands are symmetrical and there is no pain on palpation. And at the same time, I will do different range of motion. And can you spread your finger? Okay, put it down. Fist, put it up 90 degrees, up. This is passive and active. Put it down. Put your finger down, spread it 90 degrees, up. Okay, thank you so much. So this is a different type of range of motion. There are special tests for the wrist. I have to do inspect the wrist. That's the first thing is called the tunnels test. Tunnels test is what you're gonna do is this is the one I did over here. Tunnel test. Press it like this, and if there is anything, and the other thing is a Fallon test. Put it like this, 40 to 60 seconds. Do you have any pain? You have to watch it. Well, you can do both like this too, this test, and there is no any visible pain, and the Fallon and tunnel test too. And the other thing is I will do the elbow joint, the elbow. I'm gonna inspect both hands symmetrical, and there is no swelling, there is no visible deformity on both elbows. And come over here, very close here, and sit over here. And the other thing is I will do the palpation, both elbows. This is a lateral epicondyle. I'll do. Do you have any pain? Medial epicondyle and olecranon process. Both medial and lateral epicondyle, lateralis. Do you have any pain? Okay. I'm gonna do some a range of motion. What are you gonna do? Would you stand up, please, if you don't mind? Okay. What are you gonna do? Just make it, flex it. Put it down. Extend. Flex. Okay. And put it down. Okay. And the other thing is what we're gonna do, the medial, I did the movement of both right and left elbow, and after that I'm gonna go to the the shoulder, which is very important. The shoulder is the shoulder is over here. The shoulder, I have to like she cover, but it's not appropriate. I don't want to take it off, but I'm gonna start from inspection. So when I inspect the shoulder, there is no deformity, symmetrical, no swelling, and no joint deformity is visible, no inflammation or no sign of bruising. And after that, I'm gonna go to the palpation. When I do palpation, I will do on the olecraneoclavicular joint and the bursa of the humerus, the head of the humerus over here. Do you have any pain? I have to watch the patient. And at the same time, I have to acromioclavicular joint. I can start from here. Do you have any pain? So what I'm gonna do after that, I'm gonna go to the range of motion. Range of motion is I will start flexing the shoulder forward in 180 degrees, and you're gonna do like this, flex 180 degrees forward, up, and towards the back, both extend 60 degrees, and shoulder backwards, and I try to touch for both of on the right scapular, on that one too, right scapular. So at the same time, so abduct means towards, do like this, adduct, I can do both passive and active. Do you have any pain? Okay. So at the same time, what I'm gonna do is I'll do the special test on this one, which is the house sign, or what we call it, the for the shoulder is the Hawkeye sign. What you have to do, I'm gonna put the patient like this and 90 degrees, flex it, and I'm gonna put it like this. Do you have any pain? Okay, do the same Hawkeye sign. Do you have any pain? Okay, this is all about the shoulder. There is no pain, there is no deformities, there is no visible any subscapular or scapular tear or malformation. And what I'm gonna do is, the other thing is I'm going to check the neck. So what I'm going to the neck is, as I start from the first thing is, I'm gonna start from deformity. So when I see the deformity, there is no deformity, symmetrical. I can see the shoulder and from inspection, and I'll do for palpation. Palpation is what I'm gonna do. I'm gonna put both of my fingers on the in front of her ear, and TMJ, open your mouth, move your mouth side to side. Good job. TMJ is if there is any tenderness, or, and I'm gonna palpate the trapezius muscles and any paracervical around. Do you have any pain?
No.
I can go all the way. Do you have any pain
No.
around the shoulder? So there is no on the palpation, there is no any visible abnormalities. So what are you gonna do? I'm gonna do the range of motion. What are you gonna do? Flex your head towards, by your chin towards the front. Flex, extend to the right, to right of your ear, to the left. Okay, and the other thing is towards the back. Thank you. I'm gonna do the special test. What we call it is a Sperling test. The Sperling test is, I'm gonna hold the patient like this. Do you have any pain? Both right and left. Do you have any pain?
No.
Okay. This is a special test for the head and neck. And continuously to this, I'm gonna do the spine. What I'm gonna do the spine is when I do the spine over here, and I'm gonna start from inspection of the spine, the cervical or lumbar, if there is any lordosis, any shoulder height symmetry, the iliac crust symmetry or not, the skin on the crust below the buttocks over here too. And I'm gonna do all the spine over here. So after I inspect, there is like the natural S, if there is any scoliosis or lordosis, I have to inspect. Then after that, I'm gonna palpate by both fingers. Do you have any pain?
No.
Okay, I can check it if the patient has any pain by putting the check if there is any symmetrical movement. I can check it like this if there is any abnormalities. So what I'm gonna do on the spine, I have to. Would you move yourself? I'm gonna hold it like this. Move yourself to the right, to the right. Do like this. Do like this. Like this. To the left. Yes. To the left. Good job. Move. Shrug. Okay. So while I'm here, I'm gonna do the special test on what we call it the straight leg, or in order to come over here. It's not visible, I think so, from our video. Sciatica. She has to. Would you move your leg while you are standing? I'm gonna put my hands on the iliac crest. Yes, if there is a patient has a sciatic nerve pain, they can feel it from here. They cannot raise their leg. So this is all about the spine, and after that, the range of motion is bent. Come over here. Okay, what I'm gonna do the spine. Would you turn around? Come over here. Raise your leg. This is actually this is what we call it the hip. We're gonna go to the hip. We can start from inspection. If there is any hip dysplasia or any problem, I think we are far, Mira. Come over here. Any hip problem on the hip, I can inspect, and at the same time I can palpate. Do you have any pain?
No.
Okay. Turn around. Okay. The hip is what I'm gonna do. Lay down. Okay. In order to check the hip range of motion, after I did palpation, there is no swelling, there is no deformity, there is no anterior iliac crest and posterior and iliac spine, both anterior, posterior, and the lateralis. There is no any pain, and at the same time, I'm gonna check range of motion. What I'm gonna do, bend like this and try to the abdomen. Pause. Passive and active. Can you do by yourself?
Yes.
By that one too. Okay. Turn around towards. Turn. Lay down by your back. Okay. Move it. Take off your leg. Up, up, up. Yes, that one. Any pain? Okay. Thank you so much. So what I'm gonna do is I'm gonna do the two tests over here, special two tests. That one is a Thomas test and a Patrick test. The Thomas test is what you're gonna do in the Thomas test. You're gonna flex the knee. You have to flex the knee, and if there is any pain, do you have any pain? Okay. Pause. I'll do. Okay. In the Patrick test, I have to put the patient like this. Okay. You have any pain? Any pain? Okay. Thank you. The shoulder, and there is no any deformity, there is no abnormality, and all the joints, the shoulder joints are intact. There is no any abnormal finding. And what I'm gonna do is I'm going to do the knees. So I'm gonna start from an inspection. That's the first thing. The inspection is both knees are symmetrical. There is no sign of lack knees, and There is no swelling, no visible abnormalities on both knees. And after that, I'm gonna do palpation around the meniscus, medial and lateral ligament, around the patella. Do you have any pain? Okay. And what I'm gonna do, I will do different range of motion on this one. What kind of on this one on the knees? What I have to do is suprapatellar, and there are 5 different types of special tests for this one. And the first thing is the valgus and the varus. The valgus, the valgus is MCL, and the varus is stress test. The varus stress test and valgus stress test, MCL and LCL, both of them. What I'm gonna do for both of valgus and varus, I can hold the patient like this, and the valgus is medial and lateral. For varus, I have to check the patient like this. I'm gonna watch the patient. If the patient is positive for this, it's gonna be painful. Do you have any pain? I'm gonna do for both. Any pain? Okay, thank you. And the other 2 tests left that we did 2 so far. The other is Lachman and Drawer and McMurray test. The Lachman test is I have to hold it. Just relax. Lachman test, I have to do like this. And okay, and the other thing is the other thing is Drawer and a McMurray test. Drawer and the McMurray test is both of them. I have to flex 45 to the patient like this. And for McMurray test, I have to do like this. Drawer's test is pretty much do the same for both. McMurray test, if there is meniscus sign is positive or negative. So the patient doesn't have any positive problem around her knee. And this is all about the knee test. So we're gonna go to the foot and the ankle and feet and toes. I'm gonna start from the feet, and what I'm gonna do, I will start from an inspection. Both feet are symmetrical. There is no interphalangeal and the carpal bone. There is no asymmetrical, and there is no swelling, no deformities, no nodules. And I'm gonna start in the palpation. Do you have any pain? Any pain? Okay, I'm gonna move inward. Okay. Do you have any pain? Okay. So there is no pain on both feet and toes. Range of motion is for both. Range of motion for feet is the flex the toes. Can you flex your toes? Flex it up. Extend. Put it down. Flex. Down. Pause. Plantar flexion. Do upward. Inward. Abduction and abduction. For both. So the other thing is I'm gonna go to the ankle. The ankle, what I'm gonna do is this is about if there is any what we call it, if there is any nodules and dorsiflexion for both. That's one I did, the dorsiflexion. So all extremities are normal. There is no abnormal finding is visible. And this is all about our test. Thank you so much. Any question?
No.
Thank you. Thank you for allowing me, okay?